So we just concluded a 10-year follow-up study on children with Dravet syndrome in the UK, and this really led us to discover a number of developments in children over those 10 years, and that related to the frequency of seizures, how their learning progressed, and what type of comorbidities they had, and ongoing comorbidities. But we could identify really a pattern of different comorbidities emerging at different ages, and to really see how this develops over time. And we have a whole range of quite distinct different comorbidities that we identified. So comorbidities really is an expression of that a certain disorder like Dravet syndrome not only presents with epilepsy and seizures, but also presents with other associated difficulties that that particular child might encounter. So in Dravet syndrome, very common comorbidities are, for example, autism spectrum disorder features. So we see that in at least 60% of children with Dravet syndrome. What is also reported that behavioral difficulties, ADHD type behavior, we find there's difficulties with appetite and eating, we find there's difficulties with sleep. So it's a whole range of other conditions that are associated with this disorder. And we really think about Dravet syndrome as not just an epilepsy, but really an ion channel disorder that affects different regions of the brain, and different regions of the brain control different tasks that we perform. And it leads, if you have this disorder, you have seizures because your seizure threshold is lower, but also this will affect other brain regions, for example, that are important for cognitive functioning, that are important for reasoning, that are important, for example, how you interact socially with the world. So you might find different comorbidities such as autism spectrum disorder, for example, or cognitive difficulties, or behavioral difficulties. I think this is all part of Dravet syndrome presenting with that ion channel disorder in different ways. Whenever we evaluate how well a child is doing, very often in clinical practice, the main focus is how are your seizures doing? Are the seizures any better? But actually what's really important is what does that actually mean to the family and to the child. So we talk about the concept of what is quality of life. So how well are you doing and how well is your child doing? And that does not only depend on seizure frequency, but it depends on lots of different things, because families who have a child with Dravet syndrome are really confronted with a devastating diagnosis. They really struggle with this. It has got an impact on so many different aspects of their lives, and that clearly impacts on their quality of life. And there's lots of different aspects to that. So one is what we call health-related quality of life. And that means in the child, where we, for example, try to determine how well that child is able to walk, for example, how well that child is able to perform certain tasks in their day-to-day life, how well they're able to learn, how well they're able to control their movements, and also how well, for example, their epilepsy is controlled. Yeah, so all that will play into or has an impact on their health-related quality of life. But then there's also overall quality of life and satisfaction with life, and that's another aspect. So I think in our study we looked at the two things. We looked at the health-related quality of life, and we also looked at the overall quality of life of children and families who have a child with Dravet syndrome. So I think the real importance is here that you want to treat as early as possible, because we know, and this is also from our recent research when we looked at children with Dravet syndrome over 10 years, what we found is that particularly very early on, after the first year of life, there's a clear deterioration in terms of cognitive developmental function. So all those, there's a real difficult periods for children and their families where they becomes very apparent that children with Dravet syndrome are profoundly disabled, and that really happens over the first few years of life. And we would hope that by having adequate treatments and to treat very early, that might not only control seizures better, but also might have an impact on how these children progress and how they progress in their development, and that the decline is not as severe as we've previously seen. And I think there's some evidence in our data that we're presenting today at this conference showing that with recent treatments, the decline in development does not appear to be as fast as previously 10 years ago when we did our first study across the UK. So I think there's some promising signs that when you treat very, very early with the appropriate treatment, that might have a much longer lasting impact on that child's cognitive abilities and their overall quality of life. Another very important aspect also with regards to quality of life, particularly for the family, is the burden of illness. So it's a concept of the burden of illness to the family and what it means to the families and siblings. And that's been now well recognized that in Dravet syndrome, we have many parents who have, due to the fact that they have a child with a severe disorder and severe disability, that mental health problems are reported very often. So in our survey, we found that over 90% of parents of children with Dravet syndrome reported mental health difficulties, and this might be feelings of depression, anxiety, stress disorders. This is really, really important. And I think it's important for families to know that this is not unique to them. Over 90% of the families that we spoke to reported this. So this is really important, and it's important to recognize this, and it's important to talk about this and to seek help. It's because that is the best way to overcome these feelings of feeling overwhelmed, depressed, to speak to either a health professional like their GP, but come to these days of Dravet Syndrome UK family meetings to speak to other parents, to share their feelings, their worries, their anxieties, and that is really key to address this. And it is very, very well recognized and will have an impact on the overall quality of life of that family. And I think the other aspect really important is the burden of illness in terms of what it means actually to day-to-day life and, for example, the parents' jobs. So what we found that over 90% of parents told us that at least one parent had to either quit their job or cut back on hours, or because the burden on the family to look after a child that's very ill, where there's a constant worry about seizures, is significant. And that has a significant financial impact on that family, which adds to the overall stress. So this is really something that's well recognized, and it's important to highlight this, to very early to seek for extra support and help, to really speak to social services, to really speak to their primary clinician, to voice this concern, to think about what are avenues and possibilities to seek further respite care and financial support, because that's crucial. Because I think the last thing you want to do is to also having to worry about money when already you have all these worries about your child not doing as well as you expected, and really being worried about this. And then additional to that, having these financial worries, that's a real this is really challenging for families, and it's important to address this and not to feel embarrassed about this, to really be open about this, to speak to their clinicians about this, and to seek help. And I think DRAVET Syndrome UK, again, are a wealth of information, resource to really share these concerns, to seek advice, what can be done, how this can be addressed. I think it's really important. First of all, what I would expect is with these new treatments that seizure control should improve. So, and what we've seen already, for example, there have been recent treatments with fenfluramine and with cannabidiol. Particularly with fenfluramine, what we know is from the patient experience from Belgium that patients do really well, that seizures are much better controlled. And that's what recent studies have shown. So I would expect that we should be able to control seizures much better than we did in the past. And we would hope that by doing that, we can also influence the overall outcome of that child. So having less frequent seizures, whether that will also have an impact on learning, mobility, and other aspects of their quality of life. We can't promise that, because we haven't seen the long-term outcomes for those treatments yet, but I think that's very encouraging. And particularly encouraging also is the better control of status epilepticus. So I think this is something that has been reported in the past, that children who've been on new treatments, adequate treatments, have less episodes of status epilepticus, which we would again hope that that might reduce the rates of SUDEP, sudden unexplained death in epilepsy in these cohorts. So I think those are really very positive aspects of treatment, and I think very recent advances in gene therapy. So I think gene therapy, because Dravet syndrome is what we call a monogenetic disorder. So this means that Dravet syndrome is caused by one particular gene change in the SCM1A sodium channel gene. And by correcting that particular gene change, we would hope that we can really dramatically alter or even cure this disease. So I think this is really on the cards. So I think it's a real possibility. This has been shown in other neurological monogenetic disorders, and I think that's very exciting. So I think this is very exciting for families with children with Dravet syndrome, and I believe that over the next 2 to 5 years, we might see a real breakthrough.